Storage of vaccine in a refrigerator. In freezer compartment, we are maintaining the ice packs. The space maintained between the ice packs to maintain the circulation. Then the vaccine compartment. First, in chiller tray, we have to keep the OPV and measles. The temperature of OPV and measles will be minus 20 degrees Celsius. So that's why it have to be kept there. Next shelf, the first shelf we have to kept BCG and TT. Then in second shelf we have to keep the DPT and DT. In third shelf we have to keep the hepatitis B. So when we are keeping the vaccines, we have to follow the expiry. Okay, the first expiry should come first out.